This video is about a type of brain injury called stroke. Stroke is a leading cause of death and disability. For the next 10 minutes, we will define stroke, talk about stroke prevention, and discuss living with stroke. A stroke happens when the blood supply to the brain is interrupted. Without that blood and the oxygen inside the blood, brain cells cannot work and will die. In a heart attack, heart muscle begins to die if it doesn't get the blood it needs. Similarly, in a brain attack or stroke, brain cells begin to die if they don't get the blood they need. There are two types of stroke: strokes that happen because of a blockage and strokes that happen because of a rupture or leak. Shown here is an artery providing blood to your brain. Sometimes the arteries become too narrow, as in atherosclerosis, or something gets in the way of the blood flow, like a clot. When this happens, this is a blockage stroke or an ischemic stroke. Blockage strokes are the most common. When an artery ruptures or leaks, which can happen, for example, when an aneurysm bursts, blood accumulates in the tissue around the rupture. This puts pressure on the brain and keeps blood from going to where it needs to in the brain. When ruptures or leaks happen, this is a hemorrhagic stroke, also called an intracerebral hemorrhage or ICH. Hemorrhagic strokes are less common. For the rest of this video, we will be talking about strokes in adults. We will discuss risk factors, symptoms, and what happens after a stroke. We are sharing this information because we need your help. We cannot reduce stroke rates or improve quality of life after stroke without the participation of our community. So, who can have a stroke? Anyone at any age can have a stroke, though the risk for stroke increases as you get older. Over 60% of strokes occur in people aged 65 years and older. This is concerning since the older population is the fastest growing age group in the United States. This still means a lot of strokes happen in younger people too. More women than men have stroke, and in fact twice as many women die from stroke than die from breast cancer. This may be due to several risk factors: longer lifespans, health conditions related to pregnancy, and hormone therapies. It is important to note here that transgender women who undergo hormone therapy are also at greater risk for stroke. Knowledge of risk factors is important because many strokes are preventable if risk can be reduced. Additional risk factors include a history of a stroke or of a TIA, also called a mini stroke, high blood pressure, heart disease, history of smoking, alcohol use, or substance use, being overweight or obese, high cholesterol, unhealthy diet, diabetes, physical inactivity, and family history of stroke. Also, some races and ethnicities may be more at risk for stroke, including stroke at younger ages. This includes Black or African Americans, Native Americans and Alaskan Natives, and Hispanic and Latino Americans. The higher risk is due to a combination of social and economic inequalities, rural and healthcare disparities, and other associated stressors that people of racial and ethnic diversity experience while living in the United States. To reduce risk, talk to your doctor about management of your medical conditions. Also, talk to your doctor about safe ways to move towards a healthier lifestyle, such as balanced nutrition, more exercise, weight management, and reduced use of cigarettes, alcohol, or other substances. So, how do I recognize a stroke? To recognize a stroke, be fast. B is for balance. Look for sudden changes in balance or coordination, or sudden dizziness. E is for eyes. Look for sudden trouble seeing out of one or both eyes. F is for face. Look for sudden facial weakness. Part of the face may seem to be drooping. The smile may be uneven. A is for arms. Look for sudden change in arm mobility or strength. S is for speech and language. Look for impaired speech, whether talking or listening. This can include slurred speech, nonsense words, or difficulty repeating simple phrases. T is for time. Time is brain. Immediately call 911. In addition to be fast, be aware that symptoms often differ for women. These symptoms may include nausea or vomiting, seizures, hiccups, trouble breathing, pain, fainting or loss of consciousness, and general weakness. It is important to be aware of the symptoms for women so that their treatment is not delayed. What happens after the stroke? It may not be possible to prevent a stroke. For survivors, since the stroke caused brain cells to die, it may be difficult to perform certain functions. Some common conditions after stroke include muscle weakness or paralysis, problems with balance or coordination, problems producing speech sounds called dysarthria or apraxia of speech, problems with language called aphasia, like this man who has a hard time finding the right words to say, or like this woman who has a hard time understanding what others are saying. Aphasia can also mean someone has problems reading or writing. After stroke, there may be problems with thinking abilities like attention, memory, and problem solving. These cognitive problems can also make communicating with others very difficult. After stroke, someone may have feeding or swallowing problems called dysphagia, problems with vision, fatigue, and mood swings, depression, or anxiety. A stroke survivor may experience one of these problems, or they may experience several of these problems. Common conditions will improve the most in the period of time immediately after the stroke. These improvement phases are called acute and subacute recovery. Some problems may still persist and become chronic disabilities. Importantly, this is called the chronic recovery phase, which means that even though problems have persisted, and even though recovery may be slower, recovery of functions can still happen for many, many years after the stroke. To optimize recovery, it is important to work with a team of professionals. Doctors, such as neurologists, physiatrists, primary care physicians, and geriatricians. Rehabilitation professionals, such as speech-language pathologists, occupational therapists, physical therapists, and vocational rehab. Mental health professionals, such as counselors, rehabilitation psychologists, neuropsychologists, and psychiatrists. And people to help navigate recovery, such as patient navigators and social workers. To optimize recovery, it is also important to use available community resources. For example, stroke groups, brain injury groups, and groups that focus on a particular disability, community resource centers, and federal and state human services departments and resources, including disability benefits from Social Security. To optimize recovery, it is important to have the support of family members, friends, and community, and to remember that the impact of stroke extends beyond the survivor, rippling outward to family members or friends who may be serving as care partners. Caring for someone with stroke is often associated with increased strain, burden, and stress. Care partners may have negative changes in their physical activity, social activity, mental health, and their employment and financial stability. So, what can I do right now? If you've had a stroke, if you know someone who has had a stroke, or even if you've never had a stroke, you can care. C is for communicate. Communicate with your doctor about your risk. Communicate with stroke survivors, even if they have difficulty talking. Communicate with care partners to show your support. A is for advocate and help raise awareness about stroke symptoms, including those symptoms for women that are not as well known. Help advocate for rights, for accessibility, and for improved therapy coverage. R is for reach out. If you are a survivor or care partner, reach out for resources. If you haven't experienced a stroke, reach out to those stroke survivors and their care partners. They may need support to participate in life. Reach out to create volunteer and job opportunities so that stroke survivors can still find ways to contribute as they desire. E is for educate. Educate others about stroke, how to prevent it, and if it can't be prevented, then its aftermath. This will not only help with stroke prevention, but will also create a more supportive community for stroke survivors and for their care partners. An informed community is a healthier community. We must work together to prevent death and disability after stroke. New Mexicans are facing higher risks in upcoming years as our elderly population grows rapidly, as our rural disparities grow, and as our status as a majority-minority state continues. We can work together to help those impacted by stroke do what we all want to do: live life and live it fully. Thank you for watching. This project was funded by the New Mexico Brain Injury Advisory Council, a program of the State of New Mexico's Governor's Commission on Disability. Funding was awarded to Dr. Jessica Richardson at the University of New Mexico. Her team developed content and spearheaded design, working closely with the Office for Community Health. The wonderful artwork was completed by Vince Collier from Power Play Graphics. We hope you enjoyed this video and that you share it with others who may benefit from watching it.